Hi again, this is Dr. Mark Trolice from Fertility CARE, the IVF Center, and with me is Christina Rostat. We've been chronicling her journey as our medical assistant, becoming an IVF surrogate for a couple and at another program. So we've been updating, and Christina has some exciting news to share.
We are moving forward with the transfer. As you guys know, last time I did ovulate, so this is a big step for us and we're all very excited.
So with ovulation, the problem is that progesterone increases and it causes the lining of the uterus to not synchronize as well with the embryo implantation because it's not as programmed as if you provide the medication. So progesterone is going to be starting in a couple of days?
Yes, on Saturday they're going to have me start progesterone.
Okay, so about 2 days. And then your embryo transfer is going to be next week.
Yeah.
So what kind of preparation did they share with you for the embryo transfer?
Nothing as of right now, just stay on the hormones. I'll be starting doxycycline, I guess to make sure that there's no infections, the progesterone, and continue to stay on the estrase.
Okay, so your last ultrasound was yesterday, or?
Yes.
Okay, so yesterday that showed that the lining of the lining of the uterus was thick,
Yes.
optimal for embryo implantation. Progesterone gets the uterus in a better state for implantation, called the synchrotary phase, and the estrogen that she's on needs to be maintained, and that'll be adjusted during this time period after the embryo transfer. Pregnancy test within 2 weeks after. Any activity instructions afterward?
They haven't really gone over any of that stuff yet. I think they're gonna go over that during the transfer, but I would think just do everything in moderation. Don't get too stressed out.
Yeah, years ago we used to have patients undergo bed rest for several days after the transfer, and more evidence is showing of no benefit. As a matter of fact, it could even be a detriment, possibly due to the stress of just lying in bed staring at the ceiling. So the best thing to do is to resume activity, keeping it mild to moderate, and then so 2 weeks after the transfer we have a pregnancy test. And you've been in touch with the intended parents?
Not yet. I know that we're gonna meet, touch base just to kind of meet up and see where things are going, but I know that they're excited.
Well, this is a wonderful thing that you're doing. We are going to meet up again with Christina at the time of the pregnancy test and all pray for a positive result. So until next time, Dr. Mark Trolice and Christina Rostat, take care.